on your smartphone with the iHeartRadio or TuneIn apps. Connect with WCTC on Facebook, Twitter, Instagram, and YouTube by searching 1450 WCTC. And now, back to Jersey's Morning Show, Jersey Central with Bert Barron.
It's 7:37. We're back on Jersey Central on the new Talk Radio 1450 WCTC, the voice of Central Jersey. I am Bert Barron. Great to have you back with me inside the Forge Jeweler Studios. Contest is on the way. Going to give away a free one-year membership to Retro Fitness coming up a little bit later on in the show this morning, so hang on in there. You know, the birth of a child, a joyous occasion for the entire family, obviously, but for the families of more than 150,000 American babies born with a birth defect every year, it brings about fear and uncertainty. And with January being Birth Defects Awareness Month, let's welcome to the Jersey Central Newsmaker Hotline attending surgeon in the Division of Pediatric General, Thoracic, and Fetal Surgery at the renowned CHOP, the Children's Hospital of Philadelphia. We have Dr. Holly Hendrick, who is with us this morning on Jersey Central. Dr. Hendrick, good morning. It's Bert Barron. How are you?
Hi, good morning. Thank you.
That's a pretty staggering number, 150,000 babies every year. That's a remarkably high number.
It is. It's actually so common. It's 1 in every 33 babies. And as you can imagine, families are feel pretty overwhelmed when they first get a diagnosis.
Is that, based on your observations, is this 1 in every 33? Is that a number that's heading in a bad direction, or is that heading in a good direction over time?
Well, it's common, and I think people don't realize how common it is. It's as diagnosis has increased and become more accurate, I think more things are being noticed and noticed earlier and earlier. And so, you know, our goal is to try to figure out ways to make things better. And so, we feel like it feels more common.
I always thought that the type of surgery that you perform, Dr. Hendrick, is nothing short of a miracle. Can you talk about some of the conditions that can be helped for surgery while a baby is still being carried by its mother?
Well, the most common surgery we do before birth is for spina bifida, but there are other birth defects that we also address that are less common, and there's research going on to try to see if there's other things that we can do as well. And so I think the one most people have heard of is probably spina bifida. That's when the neurotube doesn't close completely, but there are also other conditions that are life-threatening that we also address.
Talk a little bit, if you could, about the long-term outcome for babies who undergo any type of fetal surgery. That they typically live long and prosperous lives, Dr. Hendrick?
Yeah, I mean, our whole goal is to reverse something that's happening before birth so that they do have a normal life. And so the outcomes are quite good in a place like CHOP that has a huge team of people from multiple specialists that come together, you know, with one goal in mind to make this baby's life better. And so it really is a sort of an orchestra of different specialties working together.
Dr. Holly Hendrick is our guest this morning on Jersey Central, attending surgeon in the Division of Pediatric General, Thoracic, and Fetal Surgery at the Children's Hospital of Philadelphia, which is a renowned organization, obviously. And we're talking about birth defects. January is Birth Defects Awareness Month. The future of fetal surgery, Dr. Hendrick, do you have a good feel about maybe some things that are on the horizon, procedures, treatments, things like that?
Well, there is continuous investigation and our continuous improvement in what we can do, and so you know it's really limited by funding to really do more research to apply more things, because we really have to have an incredible investigational component before we ever try it on a patient, and so you know that's really our limitation is the funding to really carefully plan better and discover more.
How about just getting the information out there when families and expectant moms just kind of know what's available to them? Is sometimes just getting that information out to families and people in New Jersey and Pennsylvania, is that kind of a challenge that you face also?
Well, that's a great point. So the first thing is that when a diagnosis happens, it's sometimes not clear how bad it is or what exactly it is, and so the first imperative is to really nail the diagnosis and get it right, and following that to try to figure out if there's anything that we can do about it. And so that awareness piece is really important, because sometimes there are miraculous things that can be done that can really change the outcome, 180.
A couple of springs ago, Dr. Hendrick, you were on a PBS special that was called Twice Born, Stories from the Special Delivery Unit. Did that Talk about what that experience was like, and then that kind of helped you get the word out about what you do.
Well, that was a really talented team that came and were really embedded with us, and so um, you sort of forgot they were there, and they really documented the stories of these families with a lot of care and compassion, and it was very moving to be part of that.
I wonder if part of the surprise to them is like, wow, you guys work long days. These are long hours that people are putting in at a hospital. And anybody that knows someone who works in the medical field or does what you do, it's long days and sleepless nights, I'm sure, for what you're trying to accomplish in this world.
Well, it struck me that they were working long days and long nights as well, and they were super talented, and it was fun to see them.
Well, good
Fun to
stuff.
work with them.
Excellent. How can someone get some more information about what you offer, and what can we do? What are some good resources that people can visit, maybe online, just to kind of educate and inform themselves about Birth Defects Awareness Month?
Well, listeners can learn more about CHOP at fetalsurgery.chop.edu. That's fetalsurgery.chop.edu.
Just go to that website, and there's a bunch of
Yep,
information there. Good
correct.
stuff. All right, very good. Dr. Hendrick from CHOP, Children's Hospital of Philadelphia. Great to talk to you. Have a great weekend, and good information. We appreciate what you're doing for families in Jersey and Philadelphia. Thank you so much.
Well, thank you.
All right, there goes my guest, Dr. Holly Hendrick on the Jersey Central.